Hi everyone. Welcome back to our channel, where we explore the latest breakthroughs in medical science and empower you with valuable health information. I'm your host, and today we have an incredibly exciting topic to discuss. Did you know that a simple vaccination could potentially cut the risk of developing dementia? That's right. In this video, we'll be diving into the fascinating connection between the shingles vaccination and its potential impact on reducing the risk of dementia. So, if you or your loved ones are concerned about cognitive health or want to stay up to date with the latest medical advancements, you're in the right place. Before we delve into the details, let's briefly touch upon what shingles is and why it's become an important health concern in recent years. Shingles, also known as herpes zoster, is a painful viral infection caused by the varicella zoster virus, the same virus responsible for chickenpox. After recovering from chickenpox, the virus remains dormant in your nerve tissues and can reactivate later in life, leading to shingles. Not only is shingles uncomfortable, but it can also lead to serious complications, including chronic pain. However, recent studies have shed light on a surprising benefit of the shingles vaccination. Beyond protecting against the painful shingles outbreak itself, researchers have discovered a potential link between the vaccine and a reduced risk of dementia. This finding has sparked considerable interest and raised important questions about the relationship between viral infections and cognitive health. But how does the shingles vaccine potentially cut the risk of dementia? Well, scientists believe that by preventing shingles and subsequently reducing the viral activity in the body, the vaccine may indirectly protect the brain from the harmful effects of the varicella zoster virus. This intriguing possibility has opened doors to further investigations, paving the way for potential breakthroughs in dementia PR.
According to a study of health records from almost 300,000 people in Wales, vaccination against shingles may help prevent dementia, such as that brought on by Alzheimer's disease. According to the report, receiving the vaccine cuts the risk of dementia by 20%. However, some perplexing elements of the research have sparked discussion over the robustness of the work. The paper has not yet undergone peer review and was released on the medRxiv preprint platform on May 25. According to the report, receiving the vaccine cuts the risk of dementia by 20%. However, some perplexing elements of the research have sparked discussion over the robustness of the work. The dementia infection link. The discovery of herpesviruses in the brains of deceased dementia patients in the 1990s by biophysicist Ruth Itzhaki and her colleagues at the University of Manchester in the UK gave rise to the hypothesis that viral infection may be a factor in at least some cases of dementia. Alzheimer's researchers have had disagreements with the theory. Recent research, however, indicates that neurodegenerative illnesses may be more common in those who have brain-affecting viral infections. According to research, persons who have received vaccinations against specific viral infections are less likely to acquire dementia. However, a common flaw runs across all of these epidemiological studies. Persons who receive vaccinations of any kind typically have healthier lifestyles than those who do not, suggesting that other variables may be responsible for their lower risk of illnesses like Alzheimer's. With this in mind, epidemiologist Pascal Geldsetzer of Stanford University in California and his associates chose a real-world test. A shingles vaccination campaign in Wales, which started on September 1, 2013. The inert varicella zoster virus, VZV, a herpesvirus that normally causes chickenpox and is found in most people, reawakens to produce shingles. Most often affecting older persons, shingles can result in excruciating discomfort and rashes. Nature-based research. According to data, the vaccine is more effective among individuals under the age of 80. Only individuals who were under 80 when the program began, or those who were born on or after September 2, 1933, were therefore qualified to receive the vaccination in Wales. For life, those who were born before September 2, 1933, were disqualified. After reviewing the electronic health records of 296,603 people born between 1925 and 1942, The researchers discovered that around half of those who were eligible received the Zostavax vaccine within 7 years of its release. The team also discovered that those in the eligible group had an 8.5% lower risk of dementia than those in the non-eligible group. The researchers estimated that the vaccine reduced the risk of dementia by 19.9% overall, even after accounting for the fact that only about half of the eligible individuals received the vaccination. The cutoff date for birthdays allowed for comparison of individuals who were born within a few weeks of one another. Any additional factor that might have an impact on dementia incidence, like public screening initiatives, would have had an equal impact on both populations. I think it's a very strong paper, Asherio comments. He claims that although it's possible that the various dementia rates could have happened by coincidence, the authors conducted the necessary studies to rule out any other possibility. Itzhaki is happy that, among other studies, this one supports the idea that viruses are an Alzheimer's disease cause. It's totally consistent with what we've been saying since 1991 and very gratifying, she adds, adding that the latest study is distinctive in that it ruled out other potential explanations for the lower incidence of dementia in the immunized group. Others continue to advise caution. This is a well-done study, but it is by no means conclusive, says Maria Glymore, an epidemiologist at the University of California, San Francisco who specializes in Alzheimer's disease. She points out that while Alzheimer's develops over decades, the majority of the difference in dementia rates was noted in the first 4 years following immunization. According to Geldsetzer, it's possible that the vaccine simply delays the beginning of dementia. He adds that he would like to repeat his investigation in the future to determine whether the effect lasts for longer than 7 years. The investigators also discovered that the influence was mostly felt by women because there was no statistically significant difference between the rates of dementia among males who were eligible and those who were not. Women and men appear to have shingles and dementia at different rates, although Geldsetzer is unaware of the reason why. However, detractors have seized on this inconsistency to question whether the findings support a link between the vaccine and dementia. Epidemiologist Cornelia van Duijn of the University of Oxford in the UK claims that while the experiment was beautiful, the fact that men were unaffected called into question the validity of the research. She states, "I am not convinced that prejudice or chance should be excluded." Mysterious mechanism. Moreover, it is unknown why or how the vaccine might prevent dementia or whether a more recent shot called Shingles, which has taken the place of Zostavax, will have the same impact. Zostavax was a relatively inefficient vaccination. According to a clinical investigation, the risk of shingles was only decreased by roughly 50%. According to Geldsetzer, it's feasible that the vaccine will cause an immunological reaction that lowers the likelihood of developing dementia. Glymore continues that the findings should be reproduced by looking at a different group before they have an impact on policy. She and others concur that a clinical trial, as opposed to a review of medical data, would be the most effective approach to confirm the findings. Several studies examining more recent shingles vaccines are under process, and according to Geldsetzer, it would be able to examine participants' cognitive abilities. Asherio affirms, "It would be good for all of us because it's a really important step forward." I sincerely hope it's true.
And that brings us to the end of today's video on how the shingles vaccination may potentially cut the risk of developing dementia. We hope you found this information valuable and insightful. Subscribe for more health-related content. If you enjoyed this video and want to stay updated with the latest medical breakthroughs and health tips, make sure to subscribe to our channel and hit the notification bell. By doing so, you'll never miss any of our upcoming videos that aim to empower you with knowledge and promote your well-being. If you have any questions or thoughts regarding today's topic, feel free to leave them in the comments section below. We love hearing from our viewers, and we'll do our best to respond to as many comments as possible. Lastly, please remember that the information presented in this video is for educational purposes only. It's important to consult with a healthcare professional for personalized medical advice or if you have any specific concerns about the shingles vaccination or dementia prevention. Thank you for joining us today, and we appreciate your support. Remember, taking charge of your health is a lifelong journey, and we're here to provide you with the knowledge and resources you need to make informed decisions. Until next time, stay healthy, stay curious, and keep exploring the incredible world of science and medicine. See you in the next video.